Let me turn now to Dr. Bress a little bit and ask him his thoughts in terms of populations of patients. And what do you think we should be doing in terms of identifying patients who are at risk and then monitoring them, especially when they're at high risk for cardiovascular morbidity and mortality? A lot of healthcare systems have moved towards trying to do this so-called population health. And many times as well, pharmacists play a really important role in that type of process. What are your thoughts about the present and the future of that approach?
I think that's an important question. And I think the experience out of Kaiser, who has a cardiovascular risk management service in which patients at high risk, either for their first cardiovascular disease event or those with established cardiovascular disease, can have their medication managed in a collaborative practice agreement with their provider, where medications for diabetes, cholesterol, and blood pressure are managed and optimized to get those risk factors to ideal levels. So I think establishing services like that to partner with other providers to help optimize the medication therapy to get these risk factors to ideal levels, given that there is numerous agents now, both on blood pressure, cholesterol levels, that need to be tailored individually to patients, which, as we know, is a complex integration of efficacy, safety, cost, and convenience considerations as we have shared decision-making with patients around their preferences and acceptability of different therapies.
Yeah, that's really an insightful way of presenting things. So this has been an interesting discussion, and I think it highlights the importance of identifying cardiovascular risk, practical steps to take, and at least an initial focus in terms of risk factors on LDL reduction and its central importance to reducing overall atherothrombotic risk.